Hey guys, I'm Sarah with TGH Brooksville. I'm here to show you a few things about our ventilator. This is the Puritan Bennett 980. This is the ventilator we use at this hospital. This is the main screen that you're going to see when you walk into a vented patient's room, and I want to go over what some of these things mean. This box right here is going to show you what mode the patient is being ventilated in. The ACVC means that it's an assist control mode, which means the vent is doing all of the work for the patient. Now, the patient can take breaths in between if they want to, but essentially the vent's doing all the work here. The VC means it's volume targeted, and the plus, that basically means that the entire tidal volume is getting delivered to the patient at the lowest possible pressure. It's a lung protective strategy. Everything here on the bottom of the screen that you see, these are all of our settings. That's what we want for the patient to correct their arterial blood gas or according to their disease process. That's what we want from them. However, they may be doing something different. Up here shows what they are doing. We have our peak pressure, our tidal volume, our rate, our inspiratory to expiratory ratio, our PEEP, our mean airway pressure, our minute ventilation. Those are all of the things that the patient is doing. So you can look here and figure out what they're doing differently from the settings that we have set for them. These waveforms right here, this is the pressure waveform, this is the flow waveform, and this is the volume waveform. These waveforms can give us a lot of really good information when it comes to caring properly for the patient. This waveform here, if this line here is not returning to this line, which is what we call baseline, it not returning to baseline, if it were, dropped below baseline, that would indicate auto PEEP in the patient. We see this a lot in COPD patients. If they are auto PEEPing, that means they're air trapping, then they probably need more time to exhale, to empty their lungs. That's a time that you're going to need to call your RT to make that adjustment. We might also, in that waveform, see some turbulence, and we call it the sawtooth pattern. So it looks like this, up and down, a bunch of spikes. That indicates condensation or water either in the vent circuit, or the patient has a lot of secretions and they need to be suctioned. A good habit to get into before suctioning your patient is hitting the 100% O2 button. All you have to do is press it. It tells you that how long that patient will receive that 100% FiO2, and you see that the O2 is flashing 100. You don't have to stop this unless you want to. When the time runs out, it just returns back to where it's supposed to be. So I can hit stop and see it goes right back to the FiO2 that was set previously. Right here, this letter C, that means that the patient is in a control setting. That means the vent is doing all of the work. If you see an A there, that means the patient is receiving assisted breaths, which means the vent is helping them, but still doing most of the work, but the patient's initiating their own breaths. It may be a lot of breaths, it may be a few breaths, but if you see that A, then you'll know that the patient is initiating their own breaths. And you can also tell because the frequency here that we have set is 18. So if the rate here were over 18, you would know the patient is initiating those breaths. If you were to see an S up here in the corner, that's a spontaneous mode. That means we're doing an SBT, we're seeing how the patients can do on their own before extubation. We're kind of just seeing where they're at. That spontaneous mode means that the patient is doing all of the work. We are just providing a little bit of support on our end with the ventilator to help them breathe past that ET tube, to help them breathe past that airway. You can see right here, when the vent alarms and an alarm pops up, you'll see it come over here on the side. But if you miss it, or you misunderstood, or you want to call your RT and say, hey, you know, the vent's alarming, you can press this little clipboard here and it's going to tell you the alarms and what they mean. And that's something you can tell your RT. And if you or the provider have any questions about the alarms, or if respiratory, you're on the phone with them and they have any questions, you can hit this button right here. And these are your alarms. Typically respiratory will set those accordingly, but just in case the provider has any questions about that, I just wanted you guys to know how to get there. The tidal volume waveform, if it does not return to baseline on this side here, this is the inspiratory side, that's the expiratory side. So inspiratory, expiratory. Not returning to baseline on the expiratory end is going to indicate that they have a leak somewhere. Now, chest tubes in a patient will automatically show a slight leak there in that waveform. A pneumothorax will show a leak here in this waveform. Most of the time, when you see a leak, when you see this expiratory line not returning to baseline, is because the patient's airway cuff is not fully inflated. So again, give your RT a call. Okay, now if you suction your patient and the patient starts to cough, your peak pressure is probably going to get pretty high while they're coughing, and the vent is going to alarm. To silence that alarm, you press this button right here. That is the alarm silence button, and again, you get a timer. The vent tells you alarm silence in progress, and you also have a cancel button. This vent, if it were to become disconnected, it's going to alarm. All you have to do is reconnect the patient. The vent senses that you've reconnected them and it picks up right where it left off. You see these red lights here, that means that was a critical alarm, but you've taken care of it and you know your patient's all right. You can clear those red lights. That's a good indication when you're just walking past a room. You can, from the doorway assessment, you can see, is the light green, or do I have the yellow lights, or do I have the red lights? The red lights are the most serious, most critical alarms. The yellow, not critical, but something that may need attention. And if you had any questions about what something means, you simply hold down here. It explains what this is, and you hit the more button for a longer explanation. So if you're unsure of what any of this means, you just hold down and that pops up. You can also do that from here. If you want to know what any of these things that we have set mean, hold down, hit more, and that's your explanation. Okay, as you see, we're in a control mode right now. But if I take my test lung and start breathing on my own, now I'm getting assistance. See, I'm set at a rate of 18, but I'm breathing 24. And there's my assist. And let's look at the spontaneous mode. This is what we use for our SBTs, our spontaneous breathing trials. So now I have to breathe on my own. So there's my S for spontaneous. There is always a backup rate in this mode. If a patient goes 20 seconds without taking a breath, the vent will kick in and ventilate them properly. See, it's alarming and telling me that I'm not taking large enough breaths.